Insistent for Americans to isolate. President Trump, focused on boosting the economy, is talking about ways to get back to business soon, putting him on a potential collision course with public health experts who say this is no time to lower our guard. Our team is in place and leading our coverage. Miguel Almaguer with a reality check of where we are tonight.
With nearly half of the nation's population under orders to stay at home, tonight a skyrocketing number of Americans are testing positive for the coronavirus as states struggle to contain the deadly outbreak. In New York, the number of confirmed cases statewide is doubling every 3 days. Tens of thousands are sick.
We're not slowing it, and it is accelerating on its own. We're now looking at a bullet train, because the numbers are going up that quickly.
With infections spreading fast, in part because of high density in commonly used surfaces, the governor says he needs ventilators for new makeshift hospitals like the Javits Convention Center. In neighboring New Jersey, a ventilator is keeping Jack Allard alive.
He's just a good boy.
Jack's parents, Jenny and Andy, say the recent college grad fell ill 10 days ago. Now in critical condition, the young athlete is fighting to make it to his 26th birthday next week.
He's in a coma, and the nurse was nice enough to bring an iPad and show us what he looks like, but, we're not talking.
Across the nation in Los Angeles County, 80% of coronavirus cases are adults 18 to 65 years old. And today the city reported the first death in a patient under 18. But those most in danger of turning critically ill remain the elderly. Word this afternoon, 81-year-old legendary playwright Terrence McNally died from complications of the virus. Today, the president said he wants to get Americans back to work and businesses open by next month.
I would love to have the country opened up and just raring to go by Easter.
With the virus spreading fast, many governors are threatening fines, even jail times for ignoring orders to stay away from crowds. But there is no national mandate, and some leaders are choosing to stay open for business.
Many governors today around the country have put in place shelter in place. I am not going there.
In addition to Rhode Island, states like Florida and Texas have no statewide regulations to keep residents home, leading some to worry they could become the next epicenter for the virus. Our Sam Brock is in Houston.
All of the biggest cities in Texas, including this one, have issued stay-at-home orders, but not in rural areas where some residents tell me not enough is being done to keep them safe.
As the global crisis also continues to unfold, a symbol of world unity, the Olympic Games, has now officially been postponed in Tokyo. Swimmer Katie Ledecky was a gold medal favorite.
We know that this is the right call, and we can have a little bit of time to take a step back.
Tonight, a worldwide crisis hitting home as fear and uncertainty spread across our country.
In a White House briefing that just wrapped up, there is growing concerns about New Yorkers who have left that area and perhaps gone to other states. We are told that 60% of the nation's coronavirus cases come from the New York area. Anyone that's left that area needs to self-isolate for 14 days. It comes as the number of cases explodes in states like here in California. Lester.
Yeah, a very telling warning. Miguel, thank you. Now to the battle within the battle, and that's about how we protect those trying to help us. Yet some hospitals tonight are still rationing personal equipment, the protective equipment, and pleading for more from their states, the federal government, even corporations. Here's Tom Costello.
In ERs and ICUs tonight, a pitched battle to keep patients alive, but with doctors and nurses still running critically low on protective masks, face shields, and gowns. At Leominster Hospital in Massachusetts, doctors use paper bags to store and reuse their masks as they go from patient to patient.
We are there to be at the bedside, and we will be at the bedside no matter what. So you don't think about sort of your supplies or rationing, and if you need to be at the bedside, you're going to be at the bedside.
Some healthcare workers are already sick, like San Diego nurse Megan Usich, homesick and waiting for test results, afraid of infecting others.
We're feeling sick, we're trying to get testing, and either we're not getting the testing or the testing is taking 5, 6, 7 days to get back.
Experts continue to warn hospitals could eventually need hundreds of thousands of additional ventilators. A frustrated New York governor lashed out at the White House.
Where are the ventilators? Where are the gowns? Where's the PPEs? Where are the masks? Where are they?
But the vice president insists help is coming.
Earlier today, 2,000 ventilators were shipped directly to New York. New York is truly the epicenter of the coronavirus now in our country. 2,000 more will be arriving tomorrow.
Governor Cuomo says he's bought as much protective gear worldwide as he can, but probably only enough for a few weeks. Meanwhile, companies big and small are stepping in. Ford says it will produce 100,000 face shields. It's working with 3M to ramp up production of respirator masks and with GE to expand production of a simplified ventilator. GM and Tesla also promising to make ventilators, though experts caution it's a complicated process that takes time. In upstate New York, a small creative studio is also using its 3D printers to turn out face shields for hospital staff.
We can hear the urgency in their voice, and we feel that urgency. We're working as quickly as we can to get anything into their hands as possible.
Meanwhile, the pandemic is affecting lives beyond the ICU. Emily and Billy Shear are expecting a baby girl any day, but their hospital, like many in pandemic hot zones, is not allowing spouses in the delivery room.
I'm nervous at the prospect of what happens when something goes wrong, and sad about the idea that he just won't get to be there at the birth of our second daughter.
Also tonight, the FDA has approved a self-administered kit for people to use at a test site, swabbing their own nose, then submitting that sample for COVID-19 lab work, though it may take some time to roll out. Lester?
All right, Tom Costello, thank you. With the Senate close to a deal on that huge relief package, including checks for Americans, stocks